Aldo Okote was abducted from his village in northern Uganda when he was 12 by the Lord's Resistance Army, a rebel group that emerged in the late 1980s. To initiate him into the LRA, his captors forced him to shoot his fellow captives and then dance in the blood that pooled beside the bodies.
All the captives had to jump over the dead bodies to change us mentally. They did it purposefully. They even brought bodies from far away from us to jump over, to toughen us up.
After 13 years fighting for the rebel group in Darfur and Central African Republic, Aldo was wounded by the Ugandan army in the Democratic Republic of Congo and returned home. But like many other former abductees, the transition back to civilian life has been far from easy. According to a 2012 study done by Harvard University, over 80% of war-affected children in northern Uganda suffer from post-traumatic stress disorder and psychological distress. Aldo has suffered from PTSD and severe depression, but a 16-week therapy program, developed by a US-based health center, has helped. Here, groups are encouraged to share their experiences with each other, as well as to provide each other with advice on how to work through difficult emotions like guilt, fear, and anxiety. The sessions focus on talking and art therapy, making them accessible to everyone, whether or not you can read or write. Eunice Akello was snatched by the LRA when she was 11 and held for over a year before she escaped. Returning home, she also suffered from depression, feelings of isolation, and terrifying flashbacks. A few weeks ago, she joined a therapy group.
Some friends encouraged me to join the group, and I saw how their lives have been changed.
A lack of access to medical professionals and the cost of medication means that antidepressants are out of reach for most Ugandans. But the group therapy sessions are run by community volunteers who receive training. According to the Christian NGO World Vision, which is funding the treatment program, around 80% of the sufferers recover by the end of the 16 weeks.
It is going to help people to create peace and unity among themselves in such a way that that illness which was there, it will not be there. They will see each other like normal people.
With about 25,000 former child soldiers in Uganda, the challenge of treating and rehabilitating those with psychological trauma is considerable. With group therapy, it's hoped that it's not too late for the healing process to begin.